Chapter 7 is Pharmacodynamics of Radiopaque Contrast Media. We talked about pharmacodynamics a little bit in Chapter 4, which is more specific to the drugs, and in Chapter 7, it's specific to the contrast media we use in radiology. Again, it's the study of the actions or the outcome elicited by drugs when the site of action is reached. So how is contrast media that we inject going to interact with the human body? We also have talked a little bit when we talked about non-ionic and ionic contrast media. Here are the objectives, and make sure you review those to prepare for the quiz. They talk about osmolality again on page 82. Again, this is a little bit redundant, but repetition is good. Hopefully it will embed in our brains for a long term so we can remember it for the registry exam. I don't know if you guys have experienced any vasovagal reaction with anybody at any point in your life. It's like a fainting episode. Oftentimes, one of the most common I can think of are males that are getting something done that makes them very nervous and don't want to admit they are nervous. Most commonly, I've seen it when I would do myelograms on males up to the age of 40. Once the needle is inserted into the spine, they would pass out, and it's called a vasovagal reaction. The autonomic nervous system slows down the heart rate and produces a drop in aortic pressure, and the patient faints or loses consciousness. I've also had patients who are in extreme pain. For example, I had a patient that I x-rayed a cervical spine, had a pinched nerve, so when she turned her head to do the obliques, she passed out from the pain from a vasovagal reaction. You want to be prepared for this, but oftentimes we can't because it happens so quickly, but it's pretty important we know what to do in an emergency situation. They talk about chelation effects on the bottom of page 83. These are more cardiac things that happen when the contrast media binds to our calcium ions in our blood. It can cause an adverse heart rhythm, so you might want to be familiar with those as well. Anticoagulation effects are on page 85. Our contrast media can also cause some blood thinning, so we want to be aware that when we take that needle out after doing an IVU, that we put some pressure on that spot for a while and tell the patient to make sure the bleeding has stopped before they take the bandage off. If a patient is on blood thinner or baby aspirin, they may have some blood thinning already, so it's important that we understand that our contrast media can add to that. You've probably already heard of anaphylaxis or an anaphylactic reaction. That's the worst. I mean, if a patient is going to react terribly to our contrast and go into anaphylactic shock, that's really not a good thing. Anaphylaxis is an immediate life-threatening systemic hypersensitivity reaction. They can show any of these signs and symptoms listed on page 85. Like nausea, vomiting, diarrhea, hives, rash, flushing, cyanosis, which is a blue tint to their skin, lightheadedness, unconsciousness, and even having seizures. Any of these are signs and symptoms. And the treatment needs to be immediate. If not treated immediately, it can result into death. And some of us who have been in the field for a while have had this displeasure of experiencing this with patients, and it's really not a good thing. I know from personal experience working in the CT department, this has happened to me multiple times with patients, and it just happens whether they have a reaction to the contrast or a reaction to something else, or it just happens. I do want you to realize that there's another reaction called anaphylactoid that's on page 87. What I just talked about is anaphylaxis, and this one is called anaphylactoid. It kind of mimics an anaphylactic reaction, but no prior exposure to contrast media is necessary to sensitize the mast cell. And on the previous page they talk about what mast cells are and how anaphylaxis is related to that. So make sure you read on page 85 about the mast cells, because the patient usually, just because they had contrast media once and didn't react, doesn't mean the next time they aren't going to. So it's important to understand that. Another thing that can happen is renal failure. When we inject contrast media, 10% of all acute renal failure events are caused by contrast media. Patients that are at risk for this are patients with diabetes, like what I talked about before, and also high blood pressure patients. If their renal failure is impaired for some other reason, if they have some other disease process going on, or if they are dehydrated. So we give our patients that prep and tell them not to eat or drink anything, and then we are going to inject them with our contrast media, so it can be a very dangerous thing. We have to keep an eye on our patients and make sure you tell them that when they leave to pay attention to their urine output. If you are drinking and not putting up enough urine out, or just not feeling good, they need to follow up with their physician. Down on page 89, they talk about the general adverse reactions, so you will want to read over those so you can recognize them. And then it gets into paramagnetic and ultrasound adverse reactions. You don't really need to be as concerned about those. You may just want to look them over to be a little bit familiar with them. But again, don't go into a great deal. We don't deal with these every day. And on page 91, they talk about drug-to-drug interaction, because as we take our history, it's important to know what medications our patients are on. Box 7.1 and Table 7.1 are some helpful information. Box 7.1 on page 92 gives you a list of questions to be answered before you administer contrast media to a patient. I don't know if every hospital that you guys are in are having patients fill out questionnaires or asking the patients questions, but again, documentation is key. I know some places have a BUN creatinine drawn on patients, and some is not the hospital's protocol. Again, you have to follow your hospital's protocol, but I think it's very beneficial and necessary to at least ask the questions that are on page 92. Table 7.1 on page 93 talks about different drugs that we cannot give our contrast media to a patient who has these drugs in their system, because they will interact adversely. So you will definitely want to read that section over as well. It talks about barium on the bottom of page 93. Obviously, the adverse effects of barium aren't as serious. I don't want to say if the patient has a perforated bowel and it leaks into the peritoneum, that's serious, but since the barium doesn't go through the bloodstream and permeate the membranes of the bowel, we usually don't have a problem with barium reactions. Usually it's constipation if we have any type of reaction that causes trouble. So we have to tell our patients to drink a lot of fluids or take a mild laxative after ingesting barium. Page 95 has the learning exercises that will help you prepare for the quiz, and that's it for Chapter 7. Let me know if you have any questions.